Today we'll be discussing the case of Jeanna Giese. It's October 2004. Jeanna wakes up to go to school. Just last week she was feeling fine, but on this particular day she's feeling very ill. These symptoms came out of nowhere. I'm talking fever, nausea, chills, fatigue. For days, anything you could think of, Jeanna was feeling it. Now, Jeanna went to school, she went to her volleyball practices, she even attended her own volleyball game. But despite doing this all, she was feeling absolutely terrible. So bad, in fact, it was one Saturday in particular, the very same day of her school's football homecoming game, Jeanna was so sick, she couldn't even get out of bed. Her parents knew she needed to get checked out. And despite multiple trips to the hospital and multiple tests, Jeanna kept getting sent home. None of these tests showed that something was wrong with her, and this was simply a medical mystery to everyone. But it was after her last visit to the hospital when she said just one sentence to her doctor, when everyone in that hospital stood there in panic. This was not just a simple cold. It was not even the flu. This case was looking far more serious than even the most experienced doctors would have ever imagined. Because right in front of their eyes, 15-year-old Jeanna Giese laid in front of them, infected with the indefinitely fatal rabies virus. Multiple doctors, I'm talking a full conference room of doctors, scrambled together to figure out what to do. Because at the rate things were looking like, Jeanna didn't have much more time left. In fact, she was lucky if she even survived the day. Doctors had to make the very tough decision, and what would happen next would leave even the top doctors questioning whether their decision was even worth it. This case would go down as one of the most complex cases in medical history, and you'll be shocked to see the outcome of what happened to this once healthy 15-year-old girl. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. All right, let's get into this case. Jeanna Ann Giese was born June 6, 1989 to parents Ann and John. She grew up in Fond du Lac, Wisconsin alongside three brothers, two older named Jonathan and Matt, who were 20 and 18 at the time, and the youngest BJ, who was 12. Fond du Lac looks to be a beautiful little city near a large lake with a bustling downtown and stores lining the streets. Photos look like the typical small American city depicted in movies and TV. Jeanna was 15 years old at the time of this case, just starting her sophomore year of high school, and she seemed to keep herself very busy. She excelled really well in her academics, and she was an athlete on the school's varsity volleyball team. Standing at 5'10", she had a very ideal height to do well in volleyball. Not only this, but she also played in multiple different sports. In fact, her friends gave her the nickname Jeanna the Machina because of her athletic prowess. Jeanna attended St. Mary's Springs High School, a private co-ed Catholic school, and Jeanna was looking forward to going to homecoming, taking the PSATs, and everything else high school had to offer. Not only this, but Jeanna went to church every week with her family. They attended the former Catholic church called St. Patrick's. Additionally, Jeanna loved animals. At home, she had 2 golden retrievers and 3 rabbits, and she even had dreams of becoming a veterinarian or animal rehabilitator. But while these are amazing traits for one to have, it would unfortunately be this very compassionate nature that Jeanna had that would get her into trouble. It was Sunday, September 12th, 2004, when Jeanna woke up and subsequently got ready to head to church at the former St. Patrick's in Fond du Lac, Wisconsin. As mentioned, this was something she did regularly on Sundays, and she went over to the church with her family. Everything went fine at church, the family sat through Mass as normal, and the service went on. Now, as they were coming towards the end of the service, just about 15 minutes from the end of Mass, as Jeanna sat there, she and those who were inside couldn't help but notice something out of the corner of their eyes. They just kept seeing this little small thing flying around inside of the church. So obviously they're sitting, they're trying to pay attention to the sermon, and they just see this thing flying around. Now the church had this high vaulted ceiling, and surrounding the walls were these stained glass windows. So as they're sitting there, they're having this bright light just shining on whatever it is that's flying around in their church. And as they take a look at what on earth is moving inside our church, they can see clear as day that there's a little brown bat flying around inside of the church. This bat had flown in through an open window in the church, and it continued flying from window to window, just trying to get outside, unable to find the window it came through. Now, of course, as one would expect, this drew a lot of attention to the bat, and some of the congregation seemed to be quite bothered by this. I mean, it's not every day you're trying to listen to your priest and there's a bat flying around the room. As the bat was just flying all around the audience, people began grabbing songbooks and hats, and they were just swatting this bat away from them. And finally, when the bat flew to the back of the church in an effort to put an end to the commotion, an usher reached out with his prayer book and he hit the bat down. The bat was no longer flying now. It fell right to the ground on top of the steps, and they were able to continue on with their service with zero distractions. Now, like mentioned, Jeanna was a lover of all kinds of species and animals. So as she sat there and watched this bat just get hit to the ground, she was very unsettled with this sight. And because of this, as soon as she saw the bat go down, she immediately asked her mother, like, hey, is it okay if I go see and help this poor bat? She wanted to take the bat outside and release it. So once her mom gave her the approval, she subsequently walked to the back of the church to assess the situation. Once she got up to the bat, she couldn't help but notice how cute the bat was. It was small and it laid there just helpless in front of her. The bat was lying on its stomach with its back up towards Jeanna. So Jeanna crouched down and tried to pick up the bat by the tip of its wings. As soon as she touched the bat, it screeched very loudly. And this didn't stop, it continued screeching. So Jeanna quickly began to hurry outside with the bat in hand, trying to bother it as little as possible. With the bat in one hand, she pushed the door of the church open with her hip and walked outside so she could get a good spot to release it. But while she hoped this would be a simple task, it was unfortunately far from. As Jeanna carried the bat away to a safe spot outside, all of a sudden, she began feeling this searing pain in her finger. Because as she tried to carry the bat had reached as far as it could and sunk its top left fang straight into Jeanna's left index finger. It was so bad, she actually described it as feeling, quote, like a needle injecting acid into your fingertip. Jeanna quickly scurried over to a nearby pine tree and tried to put the bat onto it. But as she tried shaking the bat off her finger, the bat would not let go. Its fang was quite literally stuck in her finger. So Jeanna had to literally pull the bat from her finger and throw it into the tree as quickly as possible. By the time it was released from her hand, Jeanna had the bat's fang inside of her finger for a total of 30 seconds. And it would take just those 30 seconds for her life to absolutely turn around. After Jeanna was able to release the bat, she hurried back inside to finish her church service. She opened the door, walked inside, and sat right back next to her mother, resuming the service as if nothing happened. When they got home, Jeanna went on to explain to her mom everything that went down. She told her that she picked up the bat and explained to her that when she tried to release the bat, it ended up scratching her. Jeanna's father was not pleased to hear this whatsoever. He was like, what were you thinking? Why did you do that? But Jeanna showed them the area and was like, look, there's no cut. It's just a little scratch. Jeanna just thought she had a little scratch she described as, quote, smaller than a pinprick. There was no noticeable cut in her skin. There were no open wounds. The only thing she noticed from this was a small puddle of blood that had formed below the surface of her finger. But with how quick the incident happened, she must have not realized that she was actually bitten. So Jeanna's mother went on to help her clean this small spot on her finger with hydrogen peroxide, and she subsequently dressed it with some bandages. At the time, many didn't believe or even know that animals like bats posed a large threat of rabies to people, which statistically was correct. Less than 1% of all bats carried the virus at the time, and even still now, that number remains the same. Regardless, even with just a scratch, if one physically encounters a wild animal like that, they should go seek medical attention. Thing is, rabies awareness wasn't as highlighted at that time. So, not thinking much of it, the family simply carried on with their lives, not knowing that this small event would change Jeanna's life forever. Now, after the bat incident in September, Jeanna was able to continue on with life. But there were some things that she was starting to notice felt a bit different. About 3 weeks after getting bit, she began noticing that the finger that got bitten was experiencing some numbness. But this wasn't the only thing she noticed, because in addition to the numbness, Jeanna's finger had begun to tingle as well. And it wasn't just that the tingles were in her finger, but these tingles were progressing all the way up to her forearm. But again, whatever happened with the bat, that was just a little scratch. She started to think of the reasons why her forearm might be tingling. And as she's thinking, she had a light bulb moment. Jeanna played on the school's volleyball team, like mentioned. So she and her parents used reason, and they figured that the reason her forearm might be tingling is because she must have just pinched a nerve during volleyball practice. Pinched nerves are common in athletes, especially in volleyball. They're doing repetitive movements of their arm and just their whole body. So it's no surprise that these repetitive movements can lead to things like injury or a pinched nerve, like Jeanna thought. So again, she didn't really think much of it and continued on with her life. Now, on Saturday, October 9th, 2004, Jeanna, along with her family, went to see the musical Jesus Christ Superstar, performed by the Sheboygan Theater Company. Even the next day, on Sunday, she spent the day shopping with them. But the day after this, on Monday, Jeanna was completely exhausted. She was just feeling fatigued. It was an eventful weekend. Maybe after some rest, she'll get some energy back. This fatigue continued on until the next day on Tuesday. And it wasn't only fatigue she was feeling on this day, but she also began developing a fever. But even with the fatigue and the fever, Jeanna figured it was all gonna pass, and she continued doing her normal daily life activities. On both of those nights, on Monday and Tuesday, Jeanna still went to her volleyball practice. On Wednesday, still not even feeling great, she even went on to take the PSATs, which is a standardized test administered by the College Board, and she scored second highest in her class. But while she was able to continue doing these great tasks, Jeanna's health was not getting any better. By Wednesday, in addition to the fever and fatigue, Jeanna began experiencing chills. And by that next day, on Thursday, this only got worse. On Thursday evening, instead of usual practice, Jeanna's volleyball team had a very important game. However, in addition to all of her other symptoms, Jeanna was feeling cold and weary. It was probably in her best interest to not play in the game. So her mom, Anne, asked her hey, are you sure you want to go? It's okay to stay home. But Jeanna didn't want to let her team down. She was determined to play, and she was like, no, I'm fine. I'm going to still go. That Thursday morning, she went to school, and then in the evening, despite the symptoms, Jeanna in fact went on to attend her volleyball game, fully ready to get on the court. After arriving at the court, Jeanna put her stuff down and she began doing her warm-up with the team. However, it didn't take too long into the warm-up for her hopes of playing to take a halt, because it was during warm-ups when Jeanna realized that her illness was a lot worse than she had thought. It was after doing passing drills to prepare for the game when all of a sudden, Jeanna's mother, Anne, noticed that she had stopped her warm-up and went straight down to sit on the benches. For the entirety of the game, Jeanna sat on that bench. Anne figured that Jeanna didn't play because she clearly wasn't feeling well. So after the game, Anne went up to check on Jeanna. Once Anne got to Jeanna, Jeanna turned to her mother and asked her hey, do you know why I didn't play? To which Anne responded, yeah, because you weren't feeling good. But this was not the entirety of the case, and it was what Jeanna said next that would make Anne realize that the situation was much serious than they initially thought. Because Jeanna went on to tell her mother, the reason I didn't play is because I got double vision. During her warm-up, Jeanna was not feeling great. Whenever the ball was passed in her direction, she was seeing two volleyballs coming at her. She actually became so dizzy, she almost passed out multiple times. With how bad she was feeling, Jeanna walked up to one of her coaches and told them hey, I'm feeling too sick to play right now. So the coach told her that she should just sit on the bench for the whole game. But even with sitting on the bench, Jeanna still was exhibiting these symptoms. She even passed out on the sidelines for a significant portion of the game. Jeanna was heartbroken that she couldn't play and be there for her team on the court, but hearing that Jeanna was having double vision was enough for her mom, Anne, to get extremely worried, because she realized that these symptoms of having double vision, chills, and tingling could indicate that something was wrong with Jeanna's central nervous system, which is the body's network consisting of the brain and spinal cord. And Anne decided that it was time to take Jeanna to go see a doctor. That following morning after the game, Anne drove Jeanna to the Fond du Lac Regional Clinic. This is a clinic that is connected to the St. Agnes Hospital in Fond du Lac, Wisconsin. At the clinic, Jeanna and her mom were met by Jeanna's pediatrician, Dr. Howard Donow. Dr. Donow was a 49-year-old father of four who had been Jeanna's pediatrician for several years. The thing that was very interesting about Jeanna, though, was that she just always was usually in good health, that despite being a patient of Dr. Donow for several years, she had only met with him once. So you can imagine Dr. Donow's shock to see Jeanna come into the clinic for an emergency visit. During the appointment, Jeanna and her mom explained the strange symptoms that had been going on. But even today, Dr. Donow thought Jeanna looked fine and healthy like she usually always would. Her speech was clear and she was standing on her own. But regardless of how she appeared, she was extremely ill. In fact, Jeanna was so sick, she would soon have very little memory of everything that would go down the next few days. The doctor thought about all the possible causes that could be causing double vision and tingling in her left arm. He knew that these were rather serious symptoms, which likely indicated a very serious problem. He thought these symptoms can indicate an infection like meningitis. Maybe it could be a brain tumor or some other inflammation of the brain. Maybe it could be multiple sclerosis, which is a progressive disease in the central nervous system. Although he didn't have a clear diagnosis, Dr. Donow knew whatever it was, it probably wasn't good. And he thought that this case was far more serious for him to provide her the correct care she needed and that she needed to go see a specialist. That's when Dr. Donow advised Anne to take her daughter across to a neurologist on the hospital's side of the building, because St. Agnes was better equipped and had the resources to best take care of neurological problems. So immediately, Jeanna and Anne headed out to the clinic towards the hospital to get further evaluation. Once they got inside and checked in, Jeanna was seen by a neurologist right away, and they went on to do a neurological exam on her. They asked Jeanna to do little tasks like balancing on her left leg and holding her arms out. And Jeanna did tip a little when trying to balance, but otherwise, everything went fine enough. The doctors soon sent Jeanna for an MRI, but after receiving the results, they saw that nothing on the scan looked out of the ordinary. By that point, there was no explanation for how Jeanna was feeling, so they really tried thinking about any strange events that could have contributed to the symptoms she had. This was when something came to Jeanna's mind. Jeanna thought, what if this somehow related to the bat bite from September? So she went on to ask her mom, like, hey, what about the bat? And she thought that this could be something that was relevant. Now, there are different versions of what happened next. Jeanna's mother, Anne, claimed that she did mention the bat bite to the neurologist, but the neurologist didn't think much of it. Whereas a spokesperson for St. Agnes Hospital stated that the doctors apparently were not told until 3 days later. Either or, by that point, the bat incident was not recorded by the neurologist, and every one of the tests Jeanna did came back normal. So because of this, they told Jeanna that she was allowed to leave the hospital. And they further told her that if she wasn't feeling better by after the weekend on Monday, then she should come back to the hospital. So as told, Jeanna and her mother left the hospital. And that evening, Jeanna ate dinner with her family before heading to bed. The next morning was Saturday, October 16th, the day of the homecoming football game at Jeanna's high school. A few days ago, Jeanna had excitedly planned to attend this game, but on this Saturday, she was so sick, she couldn't even get out of bed. So she didn't go, and she instead asked her mom if she could go to the game and take pictures of the parade floats for her. This was very unlike Jeanna. She put up with this illness, going to school, playing volleyball, doing her tests, no matter how bad she was feeling. So the fact that now she was feeling so bad that she would miss her school's homecoming game, Anne was just shocked. Throughout the day, Jeanna was exhausted and soon began vomiting. She got so sick that day that her mother insisted that they go to the emergency room. And that Saturday night, they did exactly just that. Her parents drove her to the hospital that night. And at the hospital, a neurologist did similar tests to Jeanna's previous visit. Once again, she was told to balance on one leg. But unlike before, where she slightly tipped, this time, she couldn't keep her balance at all. During this night, Anne began sending out emails to their friends and their family. She explained the situation and she just asked them for their prayers. Now, at some point, the doctor left the room and suddenly while he was gone, Jeanna again remembered the bat bite and she told her mom to make sure the doctor knew about it. So once the doctor came back in, Anne went on to explain everything that went down that previous month and explained everything that occurred after that. But after examining Jeanna's left index finger, the doctor just told them that there was nothing to worry about because the finger was healed. Jeanna went on to get an MRI, but they once again could not find anything wrong, and they again sent Jeanna home. Jeanna stated that she didn't remember much from this, but in her blog from afterwards, she wrote that she did in fact remember the following quote: "I remember sitting in a wheelchair and throwing up on my mom's blanket that was keeping me warm. I remember the neurologist having me stand on one leg, but I couldn't keep my balance. I remember that the doctor left the room and I suddenly remembered the bat bite and told my mom, who then told the neurologist. He looked at the spot on my finger where it had bit me and said that it's nothing to worry about because it healed. And I remember having my first MRI, after which I collapsed in a chair and forgot my way back to the waiting room." Jeanna and her mother went home that night. But that next morning, on Sunday, October 17th, Jeanna in fact returned to the hospital in even worse condition. She wasn't just feeling fatigue or feeling nauseous, but this time she was in and out of consciousness. By that point, once the doctors saw her, they decided that she did need to be hospitalized. And soon enough, Jeanna was admitted to stay inpatient at the St. Agnes Hospital. The doctors began running even more tests. Jeanna even went on to have a spinal tap, a procedure that takes out spinal fluid or CSF fluid in order to test for issues in the central nervous system. They tested for everything from meningitis to Lyme disease. But again, every test came back negative. Within just a few hours, Jeanna had to have a breathing tube placed. And despite the negative results from the test, Jeanna's symptoms kept on worsening. Her left arm suddenly started to jerk wildly. She could not stand up on her own anymore. She had so much excess saliva that she was unable to speak. She had a high fever of 102 degrees, and Jeanna continued to throw up more and more often. It was so bad, it was almost as if her parents were watching Jeanna in the last moments of her life. Jeanna's mother, Anne, did not want to leave her alone, and so Anne asked if they could put a cot or a folding bed in the room so that she could stay with her, and she went on to stay with Jeanna, sleeping next to her that night. Before Anne fell asleep, she described seeing a vision that woke her up immediately. Because as she shut her eyes, she described seeing a vision of a white dove with its wings stretched out. And being religious, this provided Anne comfort as she felt that it was the Holy Spirit watching over Jeanna. That next morning, on Monday, October 18th, Dr. Donow, Jeanna's pediatrician, came to check in on her. And Jeanna was looking far worse in contrast to when he'd seen her only a few days ago. Jeanna's speech this time was slurred and difficult to understand. Her left arm continued twitching, and she was throwing up more often than she initially was. Dr. Donow, like the others, was puzzled with the entire situation, and so he began asking questions to try getting to the bottom of it. He asked Jeanna about any possible contaminant in her environment. Did they travel anywhere out of the ordinary? Did they have pets? Did they use any new cleaning products? Just anything. Was there anything new introduced into her environment? They went on to tell the doctors all about Jeanna's rabbits and her school activities, when suddenly, at some point in the conversation, Anne was like, "Oh, and she got bit by a bat." Now, Dr. Donow had not previously been told about this bite, so this was news to him. The neurologist was the only one to know about the bite, but like mentioned, they brushed it off. As soon as Dr. Donow heard this, he was instantly concerned. In fact, he excused himself out of the room and he immediately went on to call the Children's Hospital of Milwaukee in Wauwatosa. As a pediatrician for over 15 years, Dr. Donow had received multiple calls from parents concerned their child might have rabies and knew that rabies was a possibility. But in those 15 years of being a pediatrician, he had never actually seen a case of rabies. Dr. Donow knew that if Jeanna had rabies, specialty care would be needed. Once he called the hospital, he was put on the phone with Dr. Nancy Ganiam, a specialist in pediatric critical care. And on this call, he told Dr. Ganiam that Jeanna's illness was a possible case of rabies and told them that he thinks she needs to be transferred over. After their conversation, Dr. Donow came back into the room to tell the family what was going on. And they subsequently prepared to transfer Jeanna to the Milwaukee Children's Hospital that same day. Rabies is a highly fatal virus which is spread to humans or to other animals from the saliva of infected animals. According to the World Health Organization, or WHO, rabies is estimated to cause 59,000 human deaths per year in over 150 countries, and about 95% of these cases occur in Africa and Asia. The rabies virus typically spreads through a bite, so if somebody is bit by an animal who has rabies, they are at risk of the virus being transmitted to them. Clinically, there are two forms of rabies. One, furious rabies, which is characterized by hyperactivity and hallucinations, and two, paralytic rabies, which is characterized by paralysis and coma. In the States, in the order from the most common, rabies is most likely to be spread from raccoons, skunks, foxes, coyotes, and bats. And in developing countries, they're most likely to be spread from stray dogs. What happens is that once somebody is bit or scratched by a rabid animal, the virus enters the body at that site and sort of hijacks the transport systems in a nerve cell, because what it does is it binds to a nerve receptor and then it just crawls through your nerves all the way through the spinal cord and then up to the brain. Once it's in the brain, it causes swelling and inflammation, and soon after it leads to a plethora of terrible symptoms. Quote, "The researchers saw the virus hijack the train transporting cell components along a neuron and drove it straight into the spinal cord. Once in the spinal cord, the virus caught the first available train to the brain, where it wrought havoc before speeding through the rest of the body, shutting it down organ by organ." It stated that the virus crawls up the body about 2 to 4 centimeters per day, and various numbers have been cited, but it seems the typical incubation period for the virus is anywhere between 3 weeks to 3 months, depending on various factors. Regardless of how long this is though, once those symptoms start showing, it typically only takes about 7 days from the onset of the symptoms for the patient to pass away from rabies. And before this would occur, the patients would suffer these terrible symptoms beforehand. It initially causes flu-like symptoms or malaise, but once it reaches the brain, that's when a lot of the severe symptoms start to come on. A very common symptom for individuals with late-stage rabies is actually hydrophobia, which refers to the fear of water. Rabies affects the part of the brain responsible for controlling swallowing, speaking, or breathing. You'll see in these videos, these patients were scared to drink water or would panic when presented with liquids to drink just because of the intense painful spasms they would get in their throat or pharynx when swallowing liquids. In fact, historically, rabies actually used to be referred to as hydrophobia due to the amount of people with the disease who'd exhibit this symptom. These patients would often suffer through things like light overstimulating them. They'd have extreme muscle spasms and gagging. Some might suffer hallucinations or seizures. Some have even experienced aerophobia, which is a fear of drafts or having air blown onto you. You might see in a lot of these cases of furious rabies specifically, those who are infected, whether it be a human or an animal, they become aggressive or scream and rage. In the late stages of rabies, the virus is able to affect the brain such that the host becomes aggressive. This is what the virus wants to happen because it wants the host to be aggressive enough to bite another animal and spread the virus. This is why you might notice rabid animals are quite aggressive and approach humans to bite them, because the virus is able to affect the brain like that so that it can continue to replicate itself. At the Children's Hospital, Jeanna was placed into the care of Dr. Nancy Ganiam. Much like Jeanna's pediatrician, Dr. Ganiam had never seen a case of rabies before, but she knew that extreme precautions needed to be followed, and she was prepared to do so. There hadn't been any documented cases of rabies being transferred from human to human. The only time this has happened was during an organ transplant. So while it was unlikely for rabies to be transferred from one human to another, it was still possible. If the infected saliva or vomit were to get into someone's open cut or get into the mucous membrane of their eyes, then this could be a possibility. And because of how deadly rabies is, the risk of transfer needed to be taken extremely seriously. Dr. Ganiam made sure that the nurse and respiratory specialist transporting Jeanna wore gowns, gloves, and masks. And until they were able to rule rabies out, every visitor, doctor, and nurse that would come into her room would need to wear full PPE when with Jeanna. As they prepared for this transfer, Dr. Ganiam went on to call a colleague for his thoughts. And this colleague was named Dr. Rodney E. Willoughby. Dr. Willoughby was a pediatric infectious disease specialist who had just recently joined the hospital 5 months earlier after previously working for Johns Hopkins Hospital in Baltimore. He had experience working in remote areas before, and he had treated very serious illnesses with very little resources. Early in his career, Dr. Willoughby had worked in the high savanna of Cameroon, treating common infections and minor trauma at a 2-room clinic. At this clinic, he relied heavily on medicinal drugs obtained from the black market, as there weren't a lot of resources available. And from this clinic, he learned how to best provide care with whatever tools were available. While he was checking labs on patients, Dr. Willoughby got a call. And when he answered, Dr. Ghaniem was like, "Hey, I have a really serious case to tell you about." Dr. Ghaniem told Dr. Willoughby all about Jeanna's symptoms, the double vision, the bat bite, the tingling, and everything else. And she explained that this might possibly be a case of a rabies infection. Now, for them to do testing for rabies, they would have needed to get tissue and fluid samples from Jeanna and send it to the Centers for Disease Control and Prevention, or CDC, in Atlanta. So Dr. Willoughby quickly went to give the hospital's lab director a heads up, telling them all about the tests they would need to do and the precautions they needed to take. Charles Ruprecht was the head of the unit in the CDC that oversaw rabies in Atlanta, Georgia. So once he learned about the suspected case in Wisconsin, he told the state officials the samples from Jeanna that he would need to do the testing. In addition to the CDC, they also went on to inform the State Division of Public Health. It was required that the State Division of Public Health was informed so that they could reach out to everyone Jeanna was around to inform them whether they've been exposed and would need to get the necessary shots. And it was after this when Dr. Willoughby and Dr. Ghaniem began searching through different medical literature about rabies to figure out the best way to move forward. They went through countless pieces of literature, and unfortunately, what they would find would be information they probably would have not hoped to hear in this situation. By that point in time, only 5 people in the world were known to have survived rabies. The thing is with these patients, though, is that every one of them had been vaccinated against rabies. Now, from all cases by that point, if a patient did not receive a vaccine immediately after exposure, the virus was always fatal. When infected with rabies, it's very important that one receives a course of the post-exposure rabies vaccine as soon as possible. The CDC states that this typically consists of 4 doses of the rabies vaccine given over 2 weeks on days 0, 3, 7, and 14. There was one major problem with this, though. Jeanna had never received the vaccine, and she was bitten over a month ago. So up until that point, this virus being fatal was looking like the unfortunate reality. Jeanna was soon transferred to the Milwaukee Children's Hospital in an ambulance. This was a pretty smooth transfer. Jeanna slept throughout the ride, and her mother chatted with the nurse and respiratory specialist. Once Jeanna arrived at the hospital, within just a few minutes, she was greeted by Dr. Ghaniem, and she was greeted by another specialist in pediatric critical care, Dr. Kelly Teves. And they went on to do an assessment on Jeanna. While Jeanna was awake and alert, she was feeling extremely weak and she was breathing very heavily, but she was still able to get through the doctor's evaluations. In response to the doctor's commands, Jeanna was able to wiggle her toes. She was able to lift her head up, and she was able to squeeze both of the doctor's hands. And it was after this brief evaluation when Jeanna was taken to the intensive care unit, or ICU. Jeanna attempted to settle into the new hospital and start on whichever treatment the doctors could provide her. But even with her severe illness, Jeanna was very concerned for her family's being. Wauwatosa is where the children's hospital she was staying was, and this is nearly an hour away from Fond du Lac, where the previous hospital and where Jeanna's house was. By that point, Jeanna could barely talk, but she still tried to ask her mom about what would happen to her brother BJ. She knew he was at school, and with Anne being at the hospital, she wouldn't have been able to pick him up. So she asked her mother, like, "Hey, how will BJ get home from school?" To which Anne replied, like, "Don't worry, it's fine. Someone will pick him up." But then Jeanna then went on to ask her mother, like, "What about you? Where will you stay?" And her mother told her, like, "Don't worry, I'll be fine. I'll stay right here if I have to." When Dr. Willoughby eventually entered the room, he was able to see Jeanna's condition. She was having a hard time keeping her eyes open. Her left arm and sometimes whole entire left body started to jerk, and eventually she began salivating and finding it difficult to swallow. They soon took a sample of Jeanna's skin from the back of her head. They took a sample of her saliva, blood, and cerebrospinal or CSF fluid. These samples were frozen, packaged with dry ice, and they were subsequently sent to the CDC in Georgia overnight to test for rabies. Later in the day, Jeanna's father, John, came down to visit her in the hospital. After staying for a few hours, he drove back to Fond du Lac, and Anne stayed at the hospital with Jeanna. Up until that point, everyone was still waiting for the results to see if Jeanna had rabies or not. So while it seemed likely, it was not official until those results came back. When John arrived back to his home that evening, he spoke to his neighbor who was a nurse, and he mentioned that Jeanna was in the hospital being tested for rabies alongside other illnesses. From what John's seen on TV, in his mind, all rabies treatment just required were shots, and he thought that'd be all Jeanna needed to do. But being a nurse, his neighbor knew that if Jeanna had rabies, it was something serious. She knew there was probably nothing they could do. Once the morning of Tuesday, October 19th came, Dr. Willoughby went on to speak to his boss, Dr. Michael Joe Chusid. Dr. Chusid was the medical director of infectious disease. And on this morning, Dr. Willoughby went to him to discuss more about the possible case of rabies. Dr. Willoughby thought it would be a good idea to assemble a team of doctors to work on this case. He suggested gathering 2 doctors from each key specialty so that they could all come together and use their expertise to come up with the best treatment plan. This included specialties like neurology, infectious disease, and critical care. It was going to be an extensive treatment plan, so he wanted all of them to be there so they would be able to gauge whether the treatment was too much or if it was just enough. Dr. Chusid thought that this was a great idea, so he subsequently went on to gather 2 doctors from each key specialty from the Medical College of Wisconsin. These were doctors who practiced at the Children's Hospital, and they were all ready to work together to figure out this case. Dr. Willoughby would actually later call this his Noah's Ark of physicians, as this was a reference to the story of Noah's Ark in the Bible, where Noah and his family gathered 2 of each species of animal on a ship to save them from a flood intended to wipe out unrighteous mankind and restore goodness on the earth. While the medical literature didn't seem hopeful, Dr. Willoughby was ready to do whatever he could for Jeanna. He didn't want to see her go from such an illness, so he searched and searched through more literature in the internet until he had an idea. And finally, after lots of searching, he was confident that he'd read enough to create his own treatment idea. In fact, this was a treatment plan he's never tried before. Dr. Willoughby had noticed a few things about rabies that inspired his treatment idea. There were people who had received treatment from rabies who were able to survive for several months before passing away. One paper from 1973 described that one person even went 133 days with the virus. Now, after these patients passed, their brains were examined, and Dr. Willoughby noticed that there was an interesting pattern found with all of them. Through the examination, they found these people showed no signs of rabies within their brain after they passed. And Dr. Willoughby reasoned that this proved that the immune system was capable of wiping out the rabies virus completely. Not only this, but through his research, Dr. Willoughby also realized that rabies didn't seem to directly destroy the body. Cells didn't die, neurons weren't destroyed, there was no significant brain inflammation, nothing about rabies directly impacted the body. He concluded that rabies don't directly cause destruction to the body, but that it instead causes something called excitotoxicity. And this is a pathophysiological mechanism in the body in which there's excessive amounts of molecules called neurotransmitters, which then overstimulates the receptors in the brain and eventually causes the cells to die. As opposed to causing destruction, it seemed that when the virus reached the brain, it rather caused excitotoxicity, which then disrupted body functions such as respiration or breathing. Usually what happens when someone gets the vaccine immediately after the bite is that the vaccine is able to do its work to fight off the virus before the virus reaches the brain. This made Dr. Willoughby realize that if the immune system had more time before the virus reached the brain, then maybe it could fight it off before anything severe happened. So the solution was that the doctors needed to protect Jeanna's brain in order to give the immune system enough time to fight off the invading virus. Now, there was a bit of an unfortunate problem. One of the most common methods of protecting the brain is to induce hypothermia by using things like cold blankets to cool the brain. The problem with this, though, is that hypothermia, or being cold, slows down the immune system's ability to fight. So doing this while, yes, you're protecting the brain, it's kind of redundant because the immune systems wouldn't be able to fight the virus off as strong or as well as it probably would need to. However, there was a method he thought of unrelated to rabies that seemed to be much more promising. In some cases of patients with epilepsy, doctors would induce a coma to protect the brain when they were having uncontrollable seizures. Doctors would induce the coma, let the brain slow down, and then they would bring the patient out of the coma. The medical director at the Children's Hospital, Dr. Mary Zupank, compared it to rebooting a computer. And it's useful as the coma would give the membranes of the brain cells time to heal. Through Dr. Willoughby's search, he also read something else that was interesting. He had read a medical paper from 1992 about a study in rats. The Pasteur Institute in Paris had discovered that the level of rabies virus decreased in infected rats when they were treated with an anesthetic called ketamine. So he thought that maybe this idea can help Jeanna as well. And the reason it could help is because ketamine blocks the natural cycle of brain cell death, which, if you remember, cell death is an outcome of excitotoxicity that occurs during a rabies infection. While this seemed promising, there was one major downside with this drug. And this is because ketamine comes with some concerning possible side effects. This includes hallucinations, especially when used in high doses. Also, up to that point, ketamine had never been tested on humans with rabies. It's only been tested on rats. So there was a lot of risk associated with doing this. However, with the state Jeanna was in, the reward definitely outweighed the risk. When Dr. Willoughby went to check on Jeanna that Tuesday morning, she was salivating much more profusely than before. Her arm jerks were far more pronounced, and very concerningly, she was no longer responsive. These were telltale signs of the very fatal rabies, but still the results were not yet in. Over at the CDC in Atlanta, Jeanna's samples finally arrived and they subsequently began testing. And by late afternoon, the results everybody anxiously waited for were finally in. Once those results came back, everyone's worst nightmare officially became a reality, because this rabies test came back positive, and the family would soon be told that Jeanna might have less than 4 hours to live. When the results came, Ruprecht at the CDC quickly called the Milwaukee Children's Hospital. Dr. Willoughby answered the phone, and Ruprecht told him, hey, we found rabies antibodies in Jeanna's blood serum and CSF fluid. Dr. Willoughby just needed to confirm what Ruprecht had told him. So he asked him, hey, are you certain? And Ruprecht replied to him, yes, Jeanna tested positive for the rabies virus. So Dr. Willoughby went on to ask, is there anything in the world, any treatment that looks promising, published or not? But to everyone's dismay, Ruprecht told him there was not. Ruprecht also went on to call the Wisconsin Division of Public Health to tell them these results. He was answered by a man named James Kazmierzak. He told him the news, and after this conversation, Kazmierzak quickly reached out to the health department in Fond du Lac. Kazmierzak told the department, hey, a resident in your city has rabies. Those in contact with her could possibly have been exposed. Here are the guidelines you need to follow. And the city then went on to ensure the proper actions were taken. No type of treatment existed that seemed promising to save Jeanna's life. And there was still major problems. The medical literature clearly showed that when infected with the virus, patients typically pass away within a week. Jeanna first started showing main symptoms on October 13th. This was 6 days ago. So if the timeline was following the ones that of those who passed away, they possibly had only 24 hours or less to save Jeanna's life. The doctors knew they were in a race against the clock. After the call from the CDC, Dr. Willoughby quickly went to inform the medical team. And soon enough, pagers began going off in the Children's Hospital, gathering up all the doctors that Dr. Chusad had chosen to work together on this case. Dr. Willoughby had all the doctors gather in a small conference room in the ICU, just 2 doors down from the room Jeanna and her parents were staying in. And at this meeting, he informed them of the unfortunate news that Jeanna had tested positive for the rabies virus. He began pulling out all of the medical papers he had been reading, and he went on to discuss the options with the team. And truthfully, these options weren't looking too hopeful. They thought that they could either, 1, send Jeanna home if she wanted to spend her last days at home with her family, or they could have her stay at the Children's Hospital where staff would be able to make her last days pain-free. By this point, it genuinely was looking like they were preparing Jeanna just to pass away. Sending her home was the last thing they wanted to do. If Jeanna was sent home without hospital support, she would likely only have a day or 2 left, which they didn't want to happen. With keeping her at the hospital, though, they had a better chance of giving her a little longer to live, and they'd likely be able to give her, 1 to maybe 3 more weeks of survival. But while they genuinely had to prepare for her final days, there still was that third option that Dr. Willoughby had in his mind. One the doctors would consider their last hope. because this option would be to carry on with the new treatment plan that was discussed earlier, to induce the coma to protect Jeanna's brain, giving her immune system some more time to fight off the virus. Before telling them this idea, Dr. Willoughby explained to the group that having doctors from every specialty was crucial, as this would provide diverse opinions and different knowledge of how treatments could affect different body systems. And he told them that if the idea sounds dumb, that any doctor could and should pull the plug on it. Dr. Willoughby then told the group that he had intended to put Jeanna in a medically induced coma and treat her with ketamine. He asked the group for their professional thoughts and other ideas, and they all began discussing the idea, especially regarding the risks involved. This treatment idea came with many serious risks. Jeanna could linger in a coma. This could tremendously affect her organs. This could cause brain damage. Dr. Kelly Teves, the pediatric critical care specialist who'd seen Jeanna at the hospital, was pained at the thought of the treatment plan not working out and just causing further damage. But to her, the strategy of protecting Jeanna's brain to gain more treatment time made sense, so she thought they should follow through with it. Also, Dr. George Hoffman, the medical director of anesthesiology, believed that, quote, if doctors do not try, they will not succeed. And he agreed that the experimental treatment was needed. But not just this, Dr. Hoffman also had some additional ideas to add. They knew ketamine had some concerning side effects, like hallucinations, for example. So Dr. Hoffman suggested that if they used the sedative midazolam, that this could help counteract these side effects. It would be able to help prevent things like excitotoxicity, and it could further protect the brain from injury. Dr. Trusid was also in favor of trying the treatment they had decided on. He was a believer in medical miracles. He thought that if they tried hard enough and believed, that they could save Jeanna. So after 30 minutes of discussion, the doctors decided that they wouldn't pull the plug and that they'd continue with the treatment. Soon after this was decided, a nurse named Anna Church went to grab Jeanna's parents to bring them into the conference room. And when they entered the crowded room, they could just see the concerned look on the doctors' faces. Dr. Willoughby was the one to break the news to the parents. He told them that Jeanna had tested positive for rabies. He explained to them that this disease is essentially always fatal, and he told them that they would do what they could to make her comfortable, whether it be at home or in the hospital, but that unfortunately, this was likely it for Jeanna. After hearing the news, Jeanna's parents, John and Anne, broke down. They were crushed to find out that their daughter was essentially in her last few days or even hours of life, and they just started thinking about what they could possibly do. This was when Dr. Willoughby delivered the news of the new treatment plan they'd been discussing. He told Jeanna's parents, like, hey, there is something we've been discussing. I have this experimental treatment I think might be a good idea to try on Jeanna. I've never done it before, but we believe it would be worth a try. Even though this seemed promising, he did have one concern he needed to let them know about. He expressed that these would be new experimental treatments, but he was hopeful, and he told them, like, hey, if you'd like to go outside to discuss this, please do. But even with being told this, the parents did not leave the room. Without receiving some type of treatment, Jeanna's hope for survival was essentially non-existent. And at this time, nobody, not the CDC or another hospital, nobody had any possible treatment that they could recommend. So her parents looked at each other, and right then and there, they agreed to this experimental treatment. To get started with this treatment, they administered a cocktail of drugs including ketamine and midazolam to medically induce Jeanna into a coma. And this marked the start of an experiment that they hoped would save Jeanna's life. Multiple different doctors, nurses, and specialists kept an eye on Jeanna's condition throughout this time, and the entire hospital seemed to be working together for Jeanna's treatment. Jeanna's vital signs were constantly monitored. They even glued electrodes to her head so that medical staff could also track her brainwaves. Even if they did manage to effectively treat the rabies, there were still some risks of other issues occurring from this treatment. For example, Jeanna could be stuck in the coma, she could become paralyzed, and Dr. Willoughby described as his worst nightmare, she could develop locked-in syndrome, a condition where cognitively she's there, but physically she's unable to move or have any muscle function. There were many things that could happen, so they needed to make sure she was continuously monitored so they could catch something if need be. By that point, Jeanna's brainwaves showed she was in deep sleep rather than a coma, and she would remain in this sleep state for about 2 days before officially entering a coma. The CDC continued to check in on Jeanna. Specifically, Charles Ruprecht had been keeping up with everything that was going on. Ruprecht listened to the doctors explain their experimental treatment plan, and he did think it sounded fair, but he had some other ideas as well. Ruprecht suggested that they could also try a new drug that was still being investigated, and this is a medication called ribavirin. Ribavirin was a potential antiviral medicine that had yet to be fully approved or studied completely yet. But after Ruprecht had suggested it, Jeanna's team of doctors met to discuss more about what he had said. They had heard good things about ribavirin, and they thought that it wouldn't hurt to add it to their plan. The ribavirin possibly had the ability to protect Jeanna's heart from infection. So in addition to the ketamine and midazolam, they added ribavirin to the treatment plan. This all happened in such a short period of time. Only 3 days had gone by since Jeanna was admitted to the hospital, and it was the very same Wednesday during the evening on October 20th when Timothy Dolan, the Archbishop in Milwaukee, went to visit Jeanna. Timothy told Jeanna, quote, "Jeanna, if you can hear me, remember the words of Jesus. Do not be afraid. Fear is useless. What is needed is trust." He went on to perform what most Catholics would call the anointing of the sick. This is a type of religious act meant to assist with healing, but also give peace and forgiveness in case the person does pass away. The Archbishop used blessed oil to make the sign of the cross on Jeanna's forehead, and he prayed over her. For someone from a religious family such as Jeanna, this act was very important. For a Catholic individual, the anointing of the sick is typically the final sacrament a person receives before passing away. Usually the people who are sick enough to receive this act, unfortunately, do not survive long after this. It's also of note that this was not performed by just any priest. This archbishop was the head of a region of the church. So for him to go see Jeanna himself, it was a meaningful act. The following day, on day 4, amantadine was added to be used as an antiviral, and they added doses of depressant benzodiazepines with supplemental sedatives called barbiturates to maintain electrical activity patterns in the brain. On day 8, they performed a spinal tap on Jeanna, and these results were actually very good. The results from this test showed an increased level of rabies antibodies in both her CSF fluid and serum. This is good because antibodies are molecules that recognize and fight foreign substances in the body. So having an increased amount of rabies antibodies meant, especially in the CSF fluid, that there were more molecules to fight off the virus in the brain. Due to the progress she was making, over the next 24 hours, they began tapering her off of the sedative medications to wake her up. They slowly tapered her off of the ketamine, and they also used diazepam to replace midazolam, as diazepam is a medication useful in treating anxiety, seizures, muscle spasms, or twitches. The next day, after the start of tapering of the medications, on the 9th day, the electrical activity in Jeanna's brain looked to be improved, and her pupils were briskly reactive, but she had no other cranial nerve function, and Jeanna showed no form of muscular movement. Not only this, but only 3 days later, on the 12th day in the hospital, Jeanna developed a high fever, so the doctors ran tests and gave her medication to try treating it. Fortunately, after some tests, they discovered that there was no culture evidence of infection, nor were her leukocyte or white blood cell counts off. And in even better news, Jeanna would show progress that would leave the doctors very hopeful. On this day, Jeanna's knee reflexes were shown to be responsive, and she was also able to open her mouth in response to pressure on her sternum, aka chest. Not just this, but 2 days later, on the 14th day, Jeanna was able to blink when eye drops were administered, and she actually regained eye movements. While these were amazing progressions, there was still one big problem though. Jeanna still had a fever, and because of this persistent fever, they ended up stopping the taper and started her back up with the initial medications, and this still, however, had no effect on her fever. So the next day, on day 15, they instead tried to reduce her room temperature by 5.5 degrees Celsius to see if this would help. Unfortunately, after a few days of having a fever, this did in fact help. Her core body temperature dropped by 3.6 degrees Celsius, and due to this, they again were able to get back to completing the medication taper by lowering her ketamine and diazepam and then continuing her on amantadine for 1 week. As they monitored her while she slowly came out of the coma, things were looking pretty fine. Lab results were good, and Jeanna's pupils were able to respond to light. But there was one problem, one Dr. Willoughby described as his worst fears. Jeanna was still unable to move. She had no movement in her body. They didn't know whether Jeanna was actually in there or if the progress she had shown with the reflexes was just some random muscle activity. And Dr. Willoughby worried that Jeanna might possibly be locked in her body, something he described as, quote, worse than death. Dr. Willoughby continued a prayer on his way home and to work, repeating, quote, "Jesus Christ, Son of God, have mercy on me, a poor sinner." And just the next day, on day 16, his prayers would finally be answered. When Dr. Willoughby arrived at the hospital that day, he went over to look at Jeanna's charts, when suddenly he was approached by a doctor who was just finishing up her shift. This doctor told him, like, "Hey, guess what? Jeanna showed some really good responses today." On this day, Jeanna was not only able to open her mouth to assist with care, but she also raised her eyebrows in response to someone speaking to her. And it would be just 3 days later after this, on the 19th day, when Jeanna would make progress that would leave an entire nation shocked. With this new experimental treatment, everyone was concerned by the possibility that Jeanna might wake up locked in or even brain dead. They didn't know if Jeanna would wake up, or if she did wake up, if she would be able to get back to her normal self. That's why people waited anxiously as Jeanna began to wake up from this coma after 2 weeks in the hospital. As Jeanna slowly woke up, Dr. Willoughby had to help Jeanna hold her eyes open as she was too weak to do it on her own. And to everyone's hope, once Dr. Willoughby let go of her eyelids, Jeanna's eyes, in fact, remained open. By that point, Jeanna's mother and Dr. Willoughby removed their masks to get a proper look at Jeanna's face. And even though she appeared to wake up, there was one problem. Jeanna wasn't looking around at all. Her eyes were fixed in one direction, and they wanted to know if Jeanna was all the way there. So Dr. Willoughby was like, "Hey, Jeanna, are you able to look over at your mother?" It was by that point everyone's hopes were answered, because Jeanna looked right over at her mother and held her gaze. And it was at that moment when they knew that Jeanna was still in there. Her mother was elated. After all the waiting, her daughter was able to wake up out of this coma and look to be on the right track for a full recovery. And over a decade later, Dr. Willoughby described that on that day when Jeanna opened her eyes and was able to fix her gaze on her mother, that was one of the happiest days of his life. Jeanna was able to wiggle her toes and squeeze hands in response to commands. She was able to preferentially fix her gaze on her mother, and although she had dystonia, or uncontrolled opening movements of her jaw, which caused her to breathe with an unusual pattern, her CT scan of her head was still shown to be normal. She was making great progress. And finally, on day 31, after they were able to not detect the virus any longer, Jeanna was, quote, "considered cleared of transmissible rabies and removed from isolation." Jeanna went on to spend the next 11 weeks recovering in the hospital, and it was an extensive recovery plan. Every morning, she had to take 15 pills, and every night she had to take 2 just to replenish everything her body needed that was lost while she was fighting off that illness. Most notably, she was taking a medication called tetrahydrobiopterin, or BH4, also known as cypropirin. BH4 is a substance naturally found in the body that helps enzymes manage amino acid levels. It's typically used for treatment of a severe form of a condition called phenylketonuria. But in this case, and for rabies in general, it's extremely helpful in helping control the effects from the rabies virus. A 2021 study has stated that, quote, BH4 is used specifically in rabies virus infection due to its reduced dosages in the cerebral spinal fluid of infected patients and the fact that it can, in theory, prevent cerebral spasms by regulating the production of nitric oxide. Jeanna described that without BH4, she would have passed away only a few months after surviving. From the day she was put into the coma, Jeanna had to be in rehab to relearn things she probably would have never imagined having to relearn again. She had to relearn how to walk, how to speak, how to stand up, pick things up, point, eat, drink. She described herself as a, quote, 15-year-old newborn baby, because everything she's learned how to do since being a baby or young child, she had to learn how to do those things again. And it wasn't just an extreme physical struggle for her, but it was also a mental and emotional struggle as well. She went from living with her family at home to being an entire hour away from them. While they did visit her regularly, it was a struggle not waking up to them in the morning or going to sleep after eating dinner with them. It was a struggle to be in the hospital and not seeing them every day at home like she used to. And it wasn't just family, but she missed everything else in her everyday life. Like mentioned, a lot of what happened when Jeanna was sick, she didn't remember it at all. And she stated that she didn't regain her memory until a couple weeks later after waking up from the coma on November 26, 2004, which is American Thanksgiving. It was on that Friday on Thanksgiving when she spent the day in the hospital playing board games with her brothers and eating food with her family. And it was finally after 76 days in the hospital, on January 1st, 2005, when Jeanna was finally able to go home. Her family was there with her, which included her mom, dad, and 3 brothers. and her dad wheeled her out of the hospital with many stuffed animals in her lap and her family by her side. And it wasn't just family who was there, because outside of those hospital doors was a plethora of photographers and news stations there capturing shots of this rabies survivor who is now going home. It was an absolute medical miracle that Jeanna was able to make it through after being infected with rabies, and not vaccinated at that. And the work by the physicians and medical team was honestly phenomenal. Most notably, Dr. Willoughby was able to create a successful treatment plan for those who were infected with rabies while unvaccinated. In fact, Dr. Willoughby's treatment of Jeanna would soon be named the Milwaukee Protocol for the treatment of rabies. According to the Wisconsin's Children's Hospital, from an article posted on May 7th, 2016, from 2004 to then, the Milwaukee Protocol had been used to save 10 other lives, 2 in the United States, 4 in Peru, and 1 each in Colombia, Brazil, Chile, and Qatar. By the end of 2019, 1 more was added to the list for a total of 11. But while there were successes, I do of course have to discuss the aftermath regarding skepticism of the protocol. It's debated very heavily in the medical field on whether the Milwaukee Protocol is effective or not. There has been a lot of discourse about the Milwaukee Protocol kind of being like a one-time, almost anomaly type thing. There have been studies that have shown the failure of the procedure in multiple other cases. Many sources have cited different numbers, but for a general estimate, according to a review as of 2020, it looks like the Milwaukee Protocol has been applied to 39 cases, and out of these cases, only 11 survived. A lot of the following information was mentioned in a podcast by Radiolab, which I would recommend checking out in the description. In a study conducted in May 2010 and published in 2012, researchers tested individuals from 2 communities in Peru who were thought to have survived untreated rabies. And 7 out of these 63 people were found to have rabies antibodies in their blood. Only 1 of these 7 people had been vaccinated, but 6 of them weren't. Now, the only way these people could have gotten antibodies in their blood is if they previously had rabies. But there was nothing to show for if they even had rabies. And at that same time, the data was inconclusive on whether they had rabies, and it just didn't reach the brain yet. But whether they had it or not, this showed that nonetheless, there's a possibility that these people were immunologically special. Because here they are, alive with antibodies after possibly contracting rabies, yet doing no treatment for it. And it wasn't just only in Peru. There was another case from Texas referred to as the Texas Wild Child. This was a 17-year-old girl who was infected by rabies in 2009 and spent time in the hospital because of this. The thing is, while in the hospital, this girl didn't get any intensive care treatment for the rabies. Not the Milwaukee Protocol, nothing. She only got 1 dose of the rabies vaccine. What's interesting is that 3 weeks went by with no intensive care treatment when this girl suddenly got better on her own and was able to leave the hospital. And what's very interesting is that Jeanna herself, when she got to the hospital, she too had antibodies in her blood. And just like the people in Peru, doctors or scientists were never able to actually recover or isolate the virus from Jeanna's body. She was just shown to have the antibodies for the virus. And every person who has survived the Milwaukee Protocol has kind of shown that similar characteristic in their blood work. Take, for example, there was also the case of 8-year-old Precious Reynolds in California. She was another girl who had the Milwaukee Protocol and survived rabies in 2011. And she too had similar blood work as well. So when you look at all of this, it almost seems like in advanced cases of rabies, people might just need to be immunologically special to survive. Researchers argue that Dr. Willoughby's protocol might have had very little to nothing to do with Jeanna's survival. And as a result, many researchers believe that the Milwaukee protocol should not be used at all anymore. One review article stated that, quote, "None of these therapies can be substantiated in rabies or other forms of acute viral encephalitis." Not only this, but another review argued that the changes made to the Milwaukee protocol anyway have altered the plan in such a way that it essentially is identical to the standard intensive care treatment for rabies worldwide. There were modifications to the Milwaukee protocol over time, with the main and last modification being the elimination of the ribavirin, the antiviral, and the barbiturates, which are sedative hypnotic medications. As a result, the only remaining elements of the original Milwaukee protocol is the use of ketamine and midazolam. So they stated that the Milwaukee protocol, quote, complicates normal intensive care unit treatment and does not add any benefits. Many treatment failures at institutions with adequate facilities have also documented this. There are no evidence-based rabies treatment guidelines, and the term Milwaukee protocol should not be used instead of provision of appropriate supportive care in an intensive care setting. It's also been stated that people should essentially stop wasting money on the Milwaukee protocol to instead put that money and effort toward preventative vaccine treatment. I couldn't find any reliable sources that stated the price, but the Milwaukee protocol is said to be very costly. In fact, it was cited that one course of the Milwaukee protocol is equivalent in resources to getting all of the kids in Bangkok, Thailand, preventatively vaccinated against rabies. So this simply might just be a better option to prevent things beforehand as opposed to doing this high-risk protocol after the fact. Not only this, but Dr. Willoughby and researchers at the time initially believed excitotoxicity was the reason the rabies virus caused such harm. But current literature has shown that that might not be the case. A review article from 2016 has stated that, quote, current literature fails to support an important role for excitotoxicity and cerebral vasospasms in rabies encephalitis, with the study concluding that they, quote, have found no supportive evidence that excitotoxicity plays an important role in rabies virus infection. Based on their studies and reviews showing that the Milwaukee protocol hasn't been successful in several other cases, many have stated they believe Jeanna, alongside others who have survived, could have just been a biological outlier. Many have stated that they believe that these individuals didn't necessarily survive because of the Milwaukee protocol, but that they survived despite it. So that just leaves the question of, if that's the case, that they're immunologically special, how come nobody was documented to have survived before Jeanna and Dr. Willoughby's treatment? The thing with Dr. Willoughby, at least, is that he gave Jeanna a shot at survival, and he was able to show people that rabies is not always this fatal disease everyone thought it was. Regardless if it is effective or not, this will be a strong debate within the medical community. Nonetheless, it still was a critical stepping stone in figuring out this oh-so-confusing virus. Before Jeanna and Dr. Willoughby's treatment, the documented survival rate of rabies when unvaccinated was 0%. But after this case and many more that have come, this rate is of course now higher. One of the reviews stated, quote, there's now consensus opinion among rabies experienced clinicians that rabies can no longer be considered as an invariable fatal disease. Rare natural human survivors have been documented and are also known to occur more frequently among other mammals. Like many other diseases like cancer, HIV, and even type 1 diabetes, these diseases at some point were considered untreatable, but now obviously the success rate for these diseases are so much higher. Looking at these diseases that were once a death sentence be so treatable now provides at least some hope that more developments towards rabies treatments will improve as time goes on. Nonetheless, this is still just such an inspiring and powerful story of survival, and really just highlights the importance of medicine and having medical professionals who do what they can to make sure they treat their patients to the best of their abilities. Jeanna continued working diligently to recover and get back to her usual normal. A case study of her recovery featured filmed progress of Jeanna on day 131 after she was hospitalized.
Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Good. Is that hard?
Not really.
Not really? Okay.
No.
Can you do cut?
Ka.
Okay, do it as fast as you can for 10 seconds.
Ka.
Okay, good.
In these videos, Jeanna is able to speak and laugh with the examiner. She's able to recite the Pledge of Allegiance from memory, and she's able to walk with her family with the aid of a walker. Although she reasonably expressed that she despaired about the recovery due to the months of rehabilitation with slow progress, this was still amazing progress for someone who was literally on a hospital bed for what most thought was her last days alive and was given such strong medications just months prior. And she was able to accomplish a lot even while undergoing rehabilitation, including getting her driver's license, going to her senior year homecoming dance, graduating high school in 2007 with honors, and graduating college with a degree in general biology. Over a decade after this incident, Jeanna has stated that every day is another day of therapy for her. She stated that she has permanent nerve damage, permanent brain damage, and she's mentioned that she still has slightly affected speech. Not only this, but she's also said that she has to maintain physical exercises due to one side of her body reacting slower than the other. But other than that, she seems to look relatively healthy and looks to be doing great things. On her public social media pages, she posts a lot about rabies awareness, and she has done many presentations to all ages raising awareness about rabies. She's taken part in conferences. She served as an ambassador for the Global Alliance for Rabies Control. In 2011, she also took a trip with her family to the Philippines, an island where the rabies virus has been eradicated. And there, she traveled to different schools and learned about all the efforts officials have taken at the island to prevent rabies. Jeanna also appears to be continuing with her passions. She started a YouTube channel with video updates kept up from how she was doing years ago.
Hey guys, for those of you who don't know who I am, my name is Jeanna Giese. In 2004, I became the first person in the world to survive rabies without the vaccination.
She's continued showing her athletic drive, competing in sled dog racing. She became a kennel assistant, and last but not least, Jeanna became a mother. In March 2016, Jeanna gave birth to 2 twins, a boy and a girl, who were featured in a video with Children's Wisconsin. Additionally, in June 2018, she had another child, a boy, to become a mother of 3. Jeanna was able to take such a traumatic experience that she stated herself was something she initially found hard to talk about, and she was able to turn it around to give motivational and educational talks and raise awareness for the topic both in person and online. Dr. Willoughby is now a close family friend of hers. He was there at her college graduation on May 8th, 2011, and he attended her wedding on September 20th, 2014. Now, surprisingly, that day in 2004 at that church was not Jeanna's last encounter with rabies. On July 2013, Jeanna again had a potential brush with the virus. On that Tuesday, when she woke up to feed her 3 huskies, she'd noticed a dead bat in their cage. And when she looked at the dogs, she noticed that one of them had bite marks. She carried her dogs to get checked out and had the bat get tested by the proper authorities to make sure everything was all good. Turns out, the bat in fact tested positive for rabies. So she subsequently had her dogs vaccinated and had them quarantined for 60 days. This is just wild considering only less than 1% of bats are rabid, and the 2 bats that she had encountered in her life just happened to both be of that 1%. Nonetheless, Jeanna stated that she has no issues with bats. She's actually stated that she loves bats and described how she even attends bat festivals that feature educational talks and presentations on them. She even has a tattoo on her shoulder displaying a cross and a bat with the words "Miracles happen" above it. On multiple accounts, she's expressed her gratitude for her survival, especially with her parents' unwillingness to give up on her and Dr. Willoughby's willingness to try to fight off the rabies. And she stated that she ensures to not take anything for granted. As an athlete, I 100% understand the brushing off of symptoms and still showing up to practice even when feeling terrible. I remember before I was diagnosed with leukemia, I was still training literally until the symptoms reached the point where I just couldn't do it anymore. And similar to Jeanna, she stopped after she was dizzy at the game because they knew that's when it was starting to look more serious. Also, just a human in general, nobody expects the worst. At the time especially, not a lot of people knew that bats could cause rabies. So when showing symptoms similar to symptoms of many different illnesses, like the flu, for example, the first thing that goes to your mind isn't going to be, oh yeah, I definitely have this very fatal illness. They took the right steps by continuing to show up at the hospital and ensuring that they mentioned any possible thing that could help get to the bottom of what was going on. And in the end, it's amazing that doctors were able to come together and use this experimental procedure for the first time to save Jeanna. World Rabies Day this year is today, September 28th, 2024, a little over 2 decades since Jeanna's encounter with the bat. It was first celebrated in 2007, and it's a global day of action to raise awareness for rabies protection. This day also marks the anniversary of Louis Pasteur's passing, who is the French chemist and microbiologist who developed the first rabies vaccine. Although there are more developments now, because of the rare amount of rabies cases, especially in the States, and the availability here of the rabies vaccine, this makes the disease a lot harder to be studied, especially regarding those who have had it for a prolonged time. But despite there being no effective treatment available for prolonged rabies, there is a huge takeaway for all of this that everyone should be aware of. If you are ever bitten by any animal or are exposed to an animal who you suspect has rabies, you should immediately seek medical care from a medical professional. Even if you're unsure if you've been bitten, but were, let's say, in the same room as a wild animal while sleeping, such as if a bat flies in your room, you should still seek medical care. And also, if you ever see a wild animal near a child or someone who isn't able to seek care on their own, you should seek medical care for them. All in all, you should take proper precautions when around wild animals or animals who you suspect may have rabies. Taking the proper precautions can help save lives. And the power of medicine is truly phenomenal. With some words of inspiration, Jeanna has stated, quote, "I never gave up. I always wanted to try. Find that thing you believe in and never let it go." Just some words of wisdom as she continues to inspire, educate, and raise awareness to many. But yes, that is it for today's case. What are your thoughts on the story? Was there anything in particular that stood out to you? The treatment plan, Jeanna's resilience? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.